So they would have to start with knowing what the situation is. It would have to depend on whether it's a problem and how big of a problem it is. If they're just abusing drugs and they're getting in trouble, but they're still able to function on their own, maybe an outpatient type treatment would be a good idea. Maybe something like where they could come in once a week or twice a week and see a counselor and get a more clear idea of what's going on and sort of track their use and track their progress, where they can actually do a lot of the work on their own. That can work for somebody who's in the milder stages, where they're just starting to get into that addictive phase and they're still in the abuse phase, or they're in the abuse phase and they're just trying to address this problem and make it less of a problem. That would work for someone like that, as opposed to someone who's completely dependent on the drug and they're not able to function, they're not able to live their life. Someone like that would require residential treatment, where they would have to be isolated from their environment so they're not able to have access to the drug, because as soon as they have any way of getting access to the drug, they will go and get the drug and go back to that pattern. So it would depend on what someone's situation is and where they are along that continuum of addiction.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.